Another air raid siren. Mothers walk out of the room with their newborn babies and get to safe places. About half an hour later, the alarm cleared. We met Halina, her husband, and their son, who was born 1 day ago. Halina is from Kiev. To escape the bombing there, she drove herself to Lviv a week ago, a car trip that took more than 7 hours.
When I saw the explosions with my own eyes, it was very stressful for me. I was worried about my baby and potential effects on the future.
Halina is not alone. This hospital has received over 150 pregnant women recently, most of them from eastern parts of Ukraine, including Mariupol, Kharkiv, and Sumy. 90 of them have delivered their babies so far.
They come here with high levels of stress. They have tears and fear in their eyes because many don't know where to live and what will happen tomorrow. They've lost their houses. All this affects their pregnancy and childbirth.
The World Health Organization estimates that over 80,000 Ukrainian pregnant women are expected to give birth over the next 3 months. Doctors say whether or not they can access prenatal care and stress reduction will have a great impact on their newborns. This hospital is the second largest maternity hospital in Ukraine. Doctors say they help more than 5,000 women deliver babies per year. But over the past month, they've seen an increase in the number of premature deliveries that they link to the crisis.
We need donations to buy the equipment for treatment of premature infants. We need equipment for the neonatal intensive care unit, incubators, mechanical ventilation. All this will give us the ability to treat such infants.
Now, mothers aren't required to pay at this hospital for their childbirth, but with the increasing numbers of pregnant women, medical facilities and healthcare system are under huge pressure across Ukraine. This is an old underground basement in the hospital. It's very restricted and low, as we can see. Whenever there is an air raid siren, doctors, nurses, and patients will come here for shelter. The hospital is expecting a new and better basement. New mothers and their infants are among the most vulnerable groups of victims during any conflict. Doctors say they need more medical and humanitarian aid, as well as psychological help to get through this difficult time. Ulay, CGTN, Lviv, Ukraine.